To get started with our presentation on fluid replacement, we're going to define some terms that you'll see throughout our presentation. First, we have euhydration, which is the state of optimal total body of water content as regulated by the brain. Hyperhydration, which is the excessive amount of water levels in your body. Hypohydration is the lack of regular water levels in your body. Electrolytes are essential for basic life functioning, maintaining electrical neutrality in cells, and they generate action potentials in nerves and muscles. An electrolyte imbalance is high or low levels of electrolytes that can disturb normal bodily functions and lead to life-threatening complications. Some more terms we can define are drinking ad libitum, which is drinking at one's pleasure, drinking to thirst, which is drinking fluids as you feel thirsty. Dehydration is the process of losing water levels. And then we have exercise-associated hyponatremia, which is a serum sodium concentration of less than 135 moles during or within 24 hours of physical activity. Now for the background on fluid replacement. Hypohydration and hyperhydration can affect athletic performance and increase health risks. Drinking behavior can be altered through education, accessibility, experience, and palatability. Some athletes don't properly hydrate themselves during physical activity to replenish the fluids they've lost. So athletes whose sweat loss exceeds fluid intake can become dehydrated during physical activity. Any dehydration greater than 3% of body weight may lead to exertional heat illness, such as heat stroke, heat exhaustion, or heat cramps. Dehydration can be prevented through proper hydration protocols.
Here we have a list of benefits of staying hydrated. Improve physical performance. Helps maintain concentration, endurance, and prevent increase in heart rate and body temperature. Improve mood. Dehydration can alter your mood, sometimes leaving you annoyed or on edge. So staying hydrated can help maintain a good mood by supporting the production and transmission of neurotransmitters in the brain, such as serotonin, dopamine, and endorphins. Assists with digestion, so you're less likely to be constipated and or bloated. So water acts as a lubricant in the digestive tract, helping food move smoothly from the mouth to the stomach and the intestines. And water also helps break down food so the body can absorb nutrients. In the stomach, water combines with stomach acids to break down the proteins. Reduce risk of headaches. Dehydration can cause brain tissue to shrink due to water loss. Now, being that the brain is made up of about 85% of water, water is definitely essential for brain function. So when the body's dehydrated, the brain cells shrink due to a loss of water from the intracellular compartment. According to the National Athletic Trainers Association position statement on fluid replacement for the physically active, both severe clinical hypohydration and hyperhydration can degrade athletic performance and are potentially fatal. Early signs and symptoms of these conditions include thirst, general malaise, which is a general feeling of discomfort, illness, or lack of well-being, fatigue, headache, and vomiting. Here we have a list of vital signs that a healthcare provider can utilize when determining a patient is experiencing fluid depletion or volume overload. We have body weight. A patient's body weight is a highly sensitive indicator of changes in volume status. So monitoring fluctuations in a patient's body weight is valuable for assessing fluid status, and that will be further discussed in this lecture. We have heart rate. When the heart rate exceeds 90 beats per minute, healthcare providers should consider fluid administration. Also in respect to blood pressure, when the systolic blood pressure falls below 100 millimeters of mercury, healthcare providers should also contemplate fluid administration. or the static vital signs, respiratory rate. Now, with respiratory rate, when the patient's respiratory rate exceeds 20 breaths per minute, healthcare providers should also think about fluid administration as well. And then we have urine output. With urine output, it would be the volume or even the color of the patient's urine that could determine dehydration status, and that will also be further discussed in this lecture. And lastly, for signs and symptoms, we have physical examination findings. There's capillary refill, which can easily be assessed on the fingertips and toes and typically occurs in under 2 seconds under normal conditions. We have edema, which is swelling, and that can be an indicator of volume overload. Tear production or lack thereof could be an indicator of dehydration. Peripheral pulses, in cases of dehydration, the pulse will typically be fast and scarcely perceptible. Skin turgor and appearance of eyes. So in severe cases of dehydration, you may observe your patient to have tinted skin and that their eyes may be sunken back into their orbital cavities. Tactile skin temperature. So traditionally cool and clammy skin can be a sign of hypovolemic shock attributed to peripheral vasoconstriction, especially in the hands and feet. Mucous membrane may exhibit a dry, sandpaper-like texture on the tongue in case of dehydration. And then lastly, we have jugular vein appearance, which can be an indicator of volume overload.
Now that we have gone over signs and symptoms, we are now going to talk about hydration assessment. A way that we can analyze this is through the change of body mass. So say players are going to start practice, going ahead and getting their body weight before practice and then catching their body weight after practice would be an accurate way to assess fluid loss. And whatever percentage of fluid loss is compared to their body weight would be one way to assess this. Another method would be 24-hour hydration status tracking. Having a baseline, their baseline hydration, and tracking it for consecutive 3 days. So checking in on their hydration over a series of days, at least 3 days, will be a good way to see where they're at in their hydration. Also, utilizing a urine-specific gravity test. This will assess their urine. You can look at the urine and see like what's in their concentration, or its concentration, its color. And on the next slide, I have provided examples of a hydration weight chart. So now that we've gone over examples of hydration assessment tools, we're now going to talk about negative impact. Body water and electrolyte imbalance can disturb the ability for prolonged exercise participation. For example, this can be seen in sweat. Sweat during exercise equates to intracellular and extracellular fluid loss. Dehydration, as small as 1% of body weight, can increase cardiovascular strain, which elevates heart rate during exercise and works against the ability for muscles to transfer heat from muscles to the outside environment. Hence, the third bullet point, increase core temperature beyond norms for environmental activity factors. Essentially, these changes impair exercise performance and can lead to heat injury. In addition, heart rate increases 3 to 5 beats per minute for every 1% decrease in body mass. Cardiovascular stress amounts to decreased cardiac output, which can be life-threatening.
As we move on from the negative impact, we are working our way towards the education portion of this PowerPoint. The purpose of this is to educate coaches and athletes on the importance of hydration and fluid replacement, as well as understanding the concepts we can use to enhance performance and ensure the well-being of the athlete during play. Some topics we'll be briefly discussing is the consequences of dehydration and fluid overload, as well as how to monitor your hydration, and how to schedule activities and modify the rules of play, as well as environmental influences of fluid requirements. Okay, so now let's talk about the consequences of dehydration and fluid overload and the serious effects it has on an athlete's performance and overall health. Starting off with dehydration, it can lead to headaches, fatigue, nausea, loss of consciousness, and gastrointestinal issues. Headaches are caused because the body is low on fluids, which can cause or trigger tension and pain in the head, as well as fatigue is due to lack of hydration, which often makes the athlete feel sluggish or even tired, which makes it harder for them to perform any physical activity. It doesn't matter if it's practice or competition. Another common effect is nausea. There's times where athletes will feel uneasy to the point where they have a feeling that they have to throw up, which is due to lack of hydration. And there are some severe cases where an athlete will lose consciousness, and this is particularly dangerous because it can lead to serious medical emergencies. And lastly, for gastrointestinal issues, the athlete may present with cramps or may have to use a restroom more frequently, which can also hinder their ability to compete or practice. Now, as we move on to the fluid overload, this can lead to fluid retention, edema, and cardiopulmonary dysfunction. Fluid retention happens when the body holds onto an excessive amount of fluid, which can cause discomfort and swelling. The best example I can think of is when you're drinking too much water and you feel like bloated or you just feel like full. That's the type of discomfort you would feel. Next, we have edema, and just like fluid retention, this is an accumulation of fluid in the tissues, which can occur in the legs, arms, and other parts of the body, and can prevent the athlete from performing to the best of their ability. And then lastly, we have cardiopulmonary dysfunction. This is a critical condition, which also has to do with excessive fluid accumulating. It can strain the heart and the lungs, leading to shortness of breath and increased heart rate. This is particularly dangerous, especially when it comes to any intense physical activity. Overall, we want to educate coaches and athletes that staying hydrated is essential and equally important to avoid excessive fluid intake to prevent these consequences from happening. Also, another way to help with that is to monitor your fluid intake and understand the individual's hydration needs, which can also help maintain a healthy balance. Next, we will cover how to monitor your hydration. We can start off with checking your urine. This is something you can do on your personal time. And if you need help identifying where it falls in the chart, you can also use a color chart. Ideally, you want your urine to be light yellow. But if you notice that your urine is a lot darker, kind of like orangish, brownish, that indicates, might be an indication of dehydration. But there are times where you go use the restroom and your urine is clear, and that might suggest that you are overhydrated. Next, another recommendation can be carrying a water bottle throughout the day. Having a water bottle with you available encourages consistent drinking, and it helps ensure that you are staying hydrated, which can intertwine with drinking water even when you're not thirsty, because thirst can be a late indicator of dehydration. So making it a habit to sip of water regularly is good practice. Lastly, we might want to consider using a hydration weight chart. This is something that was brought to my attention by Kiaa, because this is something that they do at her clinical site, where basically you calculate your body weight before and after physical activity to determine the fluid loss. Also, using this chart can help you adjust your intake accordingly to ensure that you're replenishing lost fluids effectively. And this one will be mainly done in a clinical setting. Next, I would like to discuss how we can schedule and modify activities to promote better hydration. It is essential to assess the types of activities and determine the best times to schedule them. For example, practices could be planned or should be planned during cooler parts of the day, especially in hot weather, to reduce any risk of dehydration. These can be done early mornings or late afternoons when the sun is going down, to help them, like stated previously, to reduce the risk of dehydration. Next, we have the need to adjust games and practice rules to encourage hydration. This could involve implementing mandatory water breaks during practice and games to ensure athletes have regular opportunities to hydrate. And this is something I've seen plenty of times, especially with football. Before game days, we would go and basically take the temperature. And if the temperature didn't meet CIF guidelines, then the athletes were required to take more breaks throughout their practice. And then we also want to ensure that we have hydration stations available, and we want to have them to be easy access, to encourage athletes to drink more water frequently, as well as we should monitor their water intake during activities. Coaches can keep an eye on how much the athletes are drinking to ensure everyone is staying hydrated. And most importantly, follow up with the athletes after activities to see how they feel. This can help identify any signs of dehydration and allow us for timely interventions. But overall, we want to create a supportive environment that shows that the athletes are the priority when it comes to fluid replacement. And lastly, I want to discuss the influence of fluid replacement. Having a solid grasp of fluid replacement can help athletes and coaches make well-informed decisions when it comes to fluid intake before, during, and after practices. Knowing how much to drink can impact the athlete's performance and or recovery. It is also crucial for athletes to recognize the signs of dehydration, symptoms like fatigue, dizziness, and dark urine, because that's an indicator that they need more fluids. And understanding thermoregulation, how the body cools itself through sweating can help athletes appreciate the importance of staying hydrated, especially in hot conditions. So we must not overlook the importance of hydration for cognitive function and recovery. Staying properly hydrated just helps mentally maintain mental clarity, which is essential for decision making and reaction times during competition. Overall, it is when understanding fluid replacement, it will have better outcomes for the athlete's performance and overall health. Next, we will move on to the importance of hydration in sports. This PowerPoint will correlate with the previous one because understanding the importance of hydration in sports is essential for athletes, coaches, and staff because it equips them with the knowledge they need to recognize how crucial fluid replacement is for performance and overall health. Some examples that may help with that is recognizing the signs and symptoms of dehydration. Symptoms like fatigue, dizziness, and headaches, just like we stated in the previous PowerPoint, as well as understanding thermoregulation, which was also mentioned previously, and how the body ability to maintain its temperature through sweating as well. And additionally, any cognitive functions, we should consider how hydration impacts that. And the proper hydration supports mental clarity and focus. As well as we need to make sure to develop a hydration plan tailored to each athlete's needs. Not every athlete is the same, so we want to make sure that this plan can guide fluid intake before and after or even during practice to ensure that they are performing to the best of their ability. Also, we want to be aware of potential issues like exercise-associated muscle cramping, best known as EAH. It is a serious condition that can arise from excessive fluid consumption, which can lead to low sodium levels in the body. And being able to understand the risk emphasizes for the need of a balanced hydration practice. Overall, by learning these aspects of hydration, one can better support the athlete and help them achieve full potential while maintaining their health.
Moving on to the tips portion of fluid replacements. As we know, hydration is crucial for athletes in competitive sports for performance, injury prevention, and recovery. Having athletes follow a daily hydration plan can help prevent dehydration, such as encouraging the student athlete to drink water before, during, or after exercise. Consuming 4 to 8 ounces of fluid every 15 to 20 minutes of activity can aid with fluid replacement and prevent dehydration. Adult females should consume 91 ounces of liquid, while adult males should consume 125 ounces of liquid per day. We should encourage student athletes to consume more water to replace fluids when they are in hotter environments or humid environments due to sweat loss. As we know, dehydration is the loss of more than 2% of body weight, which can reduce exercise performance, increase the risk of life-threatening heat injuries such as heat stroke, and impair mental and cognitive performance. As athletic trainers, we can weigh the student athletes before and after training, which can be useful to monitor fluid loss, or have the athletes understand how to do that on their own time. Athletes should know the signs and symptoms of dehydration, such as low energy, muscle cramping, fatigue, lightheadedness, dizziness, confusion, coordination decline, dry mouth, reduction in athletic performance, and increased heart rate and breathing. They should also feel in control of their hydration plan and know when they can ask for drink breaks if they are thirsty or feeling signs of dehydration. Continuing with the tips portion for fluids replacement. One study suggests that pre-exercise hyperhydration can help delay or reduce the adverse effects of exercise-induced dehydration. However, it should be noted that drinking only water is not effective. Instead, we should encourage athletes to hydrate with high water content fruits and veggies. And we should also encourage athletes to drink fluids from other sources like milk and juice. Maintaining electrolyte imbalance is crucial for optimum body performance. Salts and potassium are essential for nerve function, muscle performance, and nutrition absorption. We should encourage student athletes to consume sports drinks for exercise lasting over 60 to 90 minutes. Moderate coffee intake, 1 to 2 cups per day, can assist with fluid needs. However, 50 milligrams of coffee that also can be tea or decaf coffee or anything of the like, along with excess sugar, can produce a mild diuretic effect, increasing risk of dehydration. Therefore, we should not encourage students to consume caffeine or carbonated drinks, as that could increase urine production and lead to dehydration. And water should be the primary source of hydration. Lastly, drinking water first thing in the morning can aid in hydration, and little benefit is known to drinking water before bed. And we should encourage students to drink water before first thing in the morning. And if they decide to drink water before bed, that is up to them, as long as they get adequate amounts of sleep, which is important for their recovery.